Welcome to the One-Day Surgery Home Care Instruction Series. In this program, we'll cover general guidelines for tonsillectomy and adenoidectomy surgeries, including anesthesia and activity, returning to school, pain and pain medicines, diet, fever, snoring, bad breath, bleeding, and follow-up visit. After we go over these things, your nurse will also review them with you and give you special instructions from your surgeon before you leave. First, let's talk about the general anesthesia your child is receiving today. This is the medicine that helps the patient go to sleep for surgery. The effects of this medicine can last up to 24 hours, so it's common to feel sleepy or dizzy during this period. In addition, if prescription medicine for pain is being given, the feelings of sleepiness or dizziness can last for longer than 24 hours. This is why certain activities are off limits. For the next 24 hours, patients who have had a tonsillectomy or adenoidectomy should not drive a car, operate machinery, make important decisions, ride their bicycle, tricycle, go-kart, motorcycle, or play actively with others. After the surgery, and for at least 2 weeks after the surgery, they should avoid any vigorous exercises like heavy lifting, bending, or straining. For example, no jumping on a trampoline, playing baseball, running track, wrestling, or other sports activities. Any physical exertion that might stimulate bleeding should be avoided. Next, parents are often anxious about how much school will be missed. After surgery, patients are usually absent for 7 to 10 days. However, this may be different according to your surgeon. The school excuse will be based on your surgeon's recommendations. If your child is in PE, please make sure that your nurse puts on your school excuse that there is to be no PE for at least 2 weeks after surgery. Now let's talk about what your child may experience after tonsils or adenoids are removed. There will be some pain, and our goal is to help control it so that it's tolerable. Typically, the pain is bad during the first 24 hours, but it's the worst on the third day. This is the normal progression of pain for this kind of surgery and doesn't mean you're doing anything wrong if the pain increases over the first couple of days. Here are ways you can help your young patient.
Maybe it's time to take some medicine.
Your doctor will give you the medicine he thinks is best to help control your child's pain. It is important to follow whatever instructions you are given. Sometimes, children who have their tonsils and adenoids removed complain of ear pain after surgery. Typically, it's not because there's an ear infection or that the surgeon did anything to the ear. It's usually what's called referred pain, which means it hurts somewhere other than where you would expect. One more point on this topic. Pain medicines work best 30 to 45 minutes after being taken. If you offer your child something to eat in this time frame, there's a better chance they'll eat something. It's important to eat and drink after surgery. And that brings us to our next topic. Soft foods are easier to swallow, and it's better to avoid things that may cause bleeding in the throat, such as potato chips, pizza, and popcorn. The same goes for drinks. Orange juice, lemonade, and soft drinks might burn going down. But if you let carbonated drinks sit out for a while or dilute them with water, they'll be easier to swallow. It might be more difficult to get your child to eat after surgery, but drinking enough fluids is a must. Offer something to drink every 30 minutes and keep a record of how much is consumed and how often bathroom visits are made. Your doctor will want to know this information. Try popsicles and milkshakes too. Those are usually a big hit. And so is chewing gum. If your child is old enough to chew gum, it stimulates saliva glands, which results in more swallowing. This actually helps with pain. If your child isn't getting enough fluids and could be having problems with dehydration or the potential for dehydration, then call your doctor's office. It's easier to catch this early rather than waiting a few days until it's progressed to the point that it's necessary to go to the hospital for IV fluids. So be sure to keep up with the frequency of drinking and urinating. Our next topic is fever. Sometimes after surgery like this, children will run fever as high as 101 degrees. Be sure to refer to your surgeon's home care instructions for more specific information about this. The bottom line is, if your child is running any fever for longer than 24 hours, contact your doctor. Parents often report that their children are snoring more after their surgery. Increased snoring is a result of the swelling at the site of surgery. Sometimes a cool mist humidifier will help. Snoring usually gets better after about a week. If you look in the back of your child's throat after surgery, it will look black and charred. It may look the same way the next day as well. But as the days go by, it will begin to look grayish-white or greenish. It might even look like there is a little bit of pus at the back of the throat. That's called a wet scab. As the surgery begins to heal, a wet scab forms in the back of the throat and causes bad breath. There's not much that can be done about this, but gargling with warm salt water will help. The bad breath will subside once the scab falls off. This usually happens 5 to 10 days after surgery. If the scab falls off too soon, or if it comes out in big pieces, there could be some bleeding, and bleeding is one of our major concerns. It can occur in the first 24 hours after surgery or a week or so later. If you see more than a teaspoon of bright red blood coming from the mouth, this is considered an emergency, and you should call your surgeon right away. If bleeding like this happens after hours and you can't reach the doctor, go to the closest emergency room. There may also be problems with nosebleeds if an adenoidectomy was performed. These are typically a little easier to manage. Try holding pressure to the bridge of the nose with your fingers for 1 to 3 minutes. If this doesn't help, call your surgeon's office. If you can't stop the bleeding and you can't reach the doctor, then go to the emergency room. Some patients may get an antibiotic from their doctor in addition to pain medication. This is to prevent infection. Others may get a medication for nausea and vomiting. These options are up to your doctor. However, if there's a problem with nausea and vomiting and you feel your child needs a prescription to help with this, please call your doctor. Treating nausea and vomiting before they become a serious problem will help avoid dehydration. By the time a few days pass and your follow-up visit is due, your young patient should be feeling much better. Not all doctors require a follow-up appointment. However, your doctor's office will contact you to schedule an appointment if one is necessary. But in the meantime, if there are problems, questions, or concerns, please call your child's surgeon. If it's after hours, just leave your name and number, and a nurse will call you back. Please remember that the information presented here on tonsillectomy and adenoidectomy surgeries covers general guidelines. If your surgeon gives you instructions that are different from what you heard in this video, follow the instructions the doctor gives you. Also, if you have any questions about this information, please ask your one-day surgery nurse. On behalf of the one-day surgery staff and all of us here, thank you for choosing Children's of Alabama.